Welcome to the Life's Best Medicine podcast, where we are finding hope and healing one episode at a time. No appointment needed, no rubber gloves, and no coping. Just a healthy dose of life lessons to help equip you for this wild journey we call life. Hey everyone. Yes, it's July, another month down. We made it through half the year. Now we're starting the second half. Yes, Christmas is coming up and holiday. So let's get in shape this summer. Simply Snacking, who's bringing these episodes to you, is a great choice. So they have great flavors of beef and chicken, and they're individually wrapped, so you could just throw them in your purse or in your car or wherever you need to be. So it's a go-to. I'm actually out and I have to order some more, but you can order and get it. So thank you for supporting the podcast and Simply Snacking. They're getting busy too, so that's good news. All right, take care. Bye-bye. Hey everyone, this is a friendly reminder that we are here for entertainment purposes only. We may not even be that entertaining at times, but this is not medical advice. You know, talk to your doctor, check with your healthcare professionals before making any lifestyle changes or, medicine changes. What we're talking about is our clinical experience and what we've seen. And so if you really want our advice, you can consult us. You can actually consult me as a doctor, or you can consult my guest and get all your questions answered. But we can't give free medical advice because we can't pay our bills with that, but we can help to educate you a bit and allow you to think a little bit. And always reach out to your medical professional before making any lifestyle changes. Thank you. Hello and welcome back to the Life's Best Medicine podcast. I'm losing my voice because I've been talking so much, but man, what a month this has been. This has been really fantastic. And I have one of my heroes who we've actually met just recently, got to spend some time together. A lot of people know about Professor Tim Noakes, Gary Fettke, and some of the people who really stood up to the system. This is another one of those guys who's a reasonable guy who tries to look at the data and analyze it. And he's not afraid to say, wait a minute, I'm not seeing this in my practice, or maybe we haven't looked at all the data. And he's been a strong voice for us, for patients, for doctors, and for, stepping back and looking at the scientific method. Dr. Aseem Malhotra, such an honor to have you. It's such a great, I know your integrity and what you stand for, and, how your parents influence you. You have so many great things to share. And I know you're not afraid to speak up. So we can kind of just run through all the books you've written. I mean, it's just crazy. 3 books as far as I know. And I didn't even know. I was looking it up this morning. I was like, wow, you wrote a book on a 21-day immunity book for COVID for people, right? And then the Piapi diet I know of, and then a statin-free life. And so you're not afraid of controversy, and and you've been doing so much stuff. So tell people what you're doing and what you're up to these days, and how you got to be the man you are and the doctor you are today.
Wow, that's quite a great quote. First of all, lovely to be on your podcast, Brian. We've known each other for a while, so it's a real pleasure to be able to have this discussion with you, and hopefully share some of my insights and wisdom with others, which for me is always rooted in the purpose of knowledge. Ultimate purpose of knowledge is to reduce human suffering. So for me, I try and live that in every way, shape, or form. So I do it for myself, but primarily, as a doctor, our duty and responsibility is to patients and improving the quality of their lives and their health. So that's really what motivates me. And I think, people. It's always interesting when I talk to people to understand what motivates them and how did they get to where they are. For me, I think, a lot of this stems from childhood, whether it's nature or nurture. I was very fortunate to have 2 amazing parents who sadly recently, we'll come on to that later, have passed in the last few years, but 2 really wonderful parents. Both were primary care physicians, general practitioners. And in terms of, I think my character very much has been shaped by them. So my father, was very a man who lived his life on honesty, on loyalty, on integrity, on speaking the truth. My mum, equally the same, but also they were both very compassionate people. And I think that I'm lucky. I feel fortunate, even though I'm effectively an orphan now. I feel lucky that that I had both of these amazing, wonderful people as my parents. And then, you know, growing up in suburban Greater Manchester in north of England, I think I got a grounding very early on. Okay, somebody will think, hold on, you grew up with a silver spoon in your mouth, both your parents were doctors. Well, first of all, in the UK, although doctors do well, better than average for sure, it's nothing like the US. But I think my father, you know, he had very humble beginnings. I mean, he told me that he actually didn't have a pair of shoes until he was 11. He would walk to school barefoot in India. And I think that, you know, from his father, he learned about the importance of treating everybody equally. You know, you're not superior to anyone, you're not inferior to everybody. And I was in a state school. You know, I was in a state school for up until the age of 11. My best friend actually was the son of a builder. You know, and for me, I didn't ever see him in a different way. He was my buddy. And I think that culture started in me there, in terms of, which ultimately actually is a component of compassion. So I think they were both very compassionate. And without digressing too much, there are 3 stages of compassion. The first stage of compassion is to see everybody else as equal to you. The second stage of compassion, the further stage, is to see other people's needs as more important than your own. And the third stage of compassion, which is actually true altruism, is taking on the burden of others. And that taking on the burden of others, we can apply to how a mother looks after the child, for example, right? So that's how probably everybody, or certainly most mothers, and probably fathers, can relate to too. So I got that instilled in me quite early on. And then my school, you know, I love to talk about my school because, you know, I'm obviously very biased, but I think I went to the best school in the world. So my secondary school was called Manchester Grammar School. And again, that ethos, it was a private school, but actually, I think at least about a third of the pupils that were at the school actually were funded by everybody else. So, you know, these people came from one of my best friends, actually, both his parents, because of sickness and everything else, were unemployed on benefits. He was one of the brightest people I've ever known. And he was able to go to this school because the school had this ethos of, we can provide for people who can't afford, you know, intelligent, bright kids. We want to give them an opportunity. So that school had that ethos. But actually, what I loved most about my school is its motto. And in Latin, and I learned Latin at my school, the motto was sapere auda. And that means dare to be wise. Dare to be wise. And, you know, it only hit me a few years ago what that really meant, Brian, you know, because I'm also very, you know, a follower of philosophers like Socrates and Plato. I'm a huge admirer of Buddhist philosophy as well. And, you know, Socrates and Plato said to lead the good and happy life, you actually have to exercise virtues. And those virtues are wisdom, courage, justice, piety, which essentially means understanding there's something greater than yourself. You know, that can be through religion, or it can be through following just being a moral person. And then moderation. And moderation specifically in their context means not getting overly attached to things, because as Buddha also highlighted, our over-attachment to whether it's material things or even relationships to some degree, over-attachment to anything is the root of all suffering. So it's just acknowledging that. It doesn't mean that you live a life of not enjoying certain, you know, pleasures or whatever else, but it means understanding that the roots of suffering are linked to our over-attachment to things. So my school actually had, you know, very much that philosophy. So I got that. I think my values were shaped by my parents, my upbringing, my schooling, and then my dad himself always had a very strong sense of justice, and I think that for me, you know, I have a very strong sense of justice, and I hate to see injustice, and I will always act on it when I can, always. And I think that I've kind of done that throughout my career in many ways. When I became familiar with the fact that a lot of medical science and research has been corrupted, if you like, by vested interests, but also understanding that there's a lot of uncertainty. Medicine is not an exact science. So it's trying to kind of change the narrative, change the understanding, but ultimately it all comes down to reducing human suffering, or at least reducing the impact of suffering on people's mental and physical health.
Yeah, and I've seen you as a brilliant guy with all the philosophy. I see stuff you post, and it's very refreshing, is very important. But you're not afraid to stand up. I mean, it's one of those things. That's what I actually had the honor of interviewing Gary and Belinda Fetke, Professor Noakes recently, and I said, was there ever a time when he said, forget it, it's not worth it, it's not my fight to fight, I'm going to sit down? And they said never crossed their mind. They said there were hard days when he wanted to give up, and Belinda said, no, you're going. And I didn't even know Professor Noakes has been happily married for 55 years, and his wife was there supporting him through all this. But you just stand up, and really, a lot of us in medicine, as you know, we just want to coast along and just be in the middle of the pack where no one sees us and we don't stand out. That's just the nature of most doctors. But I saw you standing up early for what you believed. And I thought, wow, this guy, he better not be nutty. Let me look at what you're talking about and looking at your research. And when you present your facts and there's certain people who stand up and say there's a problem and we have to look at this. And you're going up against the machine where everyone has the same mindset. And you're the one who says, wait a minute, I see it differently. Here's my clinical experience. Like, what motivates you to do that?
Yeah. So just very briefly, on a slightly lighter note, you say going up against the machine. It reminds me of one of my favorite bands as a teenager was actually Rage Against the Machine. But we'll come back to the machine because I think there's a narrative we need to change on understanding what actually the machine is. But I think, Brian, so of those virtues we talked about earlier, Maya Angelou said, and other people have said the same thing, of all the virtues, courage is the most important, because without courage, you can't practice the other virtues consistently. Okay. But for me, more than courage, I see it as being rational. And I think Jordan Peterson, the clinical psychologist, articulates this very well. He says that it's not safe to speak the truth, especially when you're going up against the grain. So it's not safe to speak, but it's even less safe to not speak, because even if in the short term, it gives you some avoidance of pressure or threat to you, in the long term, it's going to harm you, and actually come back to the fact that one, we don't live in cocoons. We live in societies, and we're all interconnected. And therefore, for me, in my brain, I rationalize it that anything that's damaging to society is actually damaging to the individual. And we know also good health is linked to communities and societies and strong societies. So I think there's that aspect of it. But actually, there's a way of simplifying it even further. So there's a very elegant analytical framework, as you know, Brian, we've talked about this before, for teaching and practicing medicine. And I actually think this analytical framework, I've been thinking about this recently, can also be used in terms of how we all approach life to give us the best quality of life for the longest possible. And that is the evidence-based medicine triad. So we're in the middle of the triad is aiming to improve patient outcomes, which means relieve suffering, manage risks, and treat illness. But to do that, we incorporate our clinical expertise and intuition and our wisdom, best available evidence, and finally, last but not least, taking into consideration individual patient preferences and values. And any deviation from that, for me, ultimately is going to either give you suboptimal patient outcomes or cause harm. And when you go and you look at that framework and then you branch out and go upstream, you find, for example, what I learned in the last few years and I've campaigned on extensively, is that much, if not most, of the research that drives clinical decision-making is either poor quality, often corrupted by commercial interests, and we talk about that. And then patients aren't actually being given information in a way that's understandable to them for them to make informed choices. And when you think about it, what's at the root of this are these big corporations that have got increasingly unchecked power over the last 2 or 3 decades. But their motives are not for public health or improving your health. Their motives are to maximize profit for their shareholders. That's their legal obligation. And in the process of doing that, Brian, they manipulate data. They exaggerate the benefits of their drugs and the safety, right? And then you can see what happens downstream. And you just need to look around. What's going on with health around the world? What's been happening over the last couple of decades? We have increasing problems with obesity. And of course, we can talk about the food industry there. But we've also ultimately, certainly in the UK, life expectancy has stalled in the last decade. We've got people living in increasing years in poor health. So I look at it from a perspective also as a doctor saying, well, actually, we in some ways are stewards for people's health, for patients' health. So are we doing our job properly? That's the one question to ask ourselves. But ultimately, if population health is getting worse, we have to understand why, and also what is our role to play in that. I think it's very clear at the root of this problem, and I've looked at this in a lot of depth, is what I've already said before. You know, there's something called Tom Frieden's, the CDC's health impact pyramid, which was created by Tom Frieden. Okay, and if you look at the health impact pyramid, which is interesting, it gives you an idea of what's going to have the biggest impact on population health and what's going to have the smallest impact. And the smallest impact, which may surprise a lot of people, is actually the individual consultation. You know, education and clinical interventions. The biggest impact that he's put at the bottom of this pyramid is described as socioeconomic factors. But what does that actually mean? What's the biological mechanism behind that? That's the biggest impact on population health. Well, actually, we need to rephrase it and actually talk about the biopsycho-socioeconomic model, the political determinants, and the commercial determinants of health. So actually, that's at the root of the problem, because if we've talked about the fact, you know this very well, about, you know, we can reverse type 2 diabetes from lifestyle change, for example. But what's driving the obesity epidemic isn't just the lifestyle, it's actually what are the causes of the causes. So if you're, for example, Brian, in a low pay, high demand, low control job, which is probably millions of Americans, right? You don't even have the agency, you don't even have the resources in some ways, or or less likelihood of even being able to afford healthy food. You know, the cheap junk food is the easy option. It's also now probably got data suggesting it's addictive, and addiction is the opposite of free will. And then the reason you're in a low paid job often is because big corporations, in order to maximize their profits for their shareholders, they will give people the lowest amount of pay that they can just about manage to work on, for example. And then that's going to also affect their health. So in fact, there's a guru in this area called Professor Michael Marmot, public health professor, who's done a lot of work on social inequalities in health. And one of the statements he made, and I've been highlighting this in my recent lectures, is a poor quality and stressful job, Brian, is more damaging to health than being unemployed. So when politicians talk about creating jobs, we shouldn't let them just stop at that. Hold on a minute, what kind of jobs, right? And then as an individual, you know, what you need to be thinking about as a person, as an individual is, and this is what I think, and, you know, maybe it's easy for us in our profession as doctors, is, you know, to enjoy your job, or to make sure your job is a good job, right? You want it to be something that well, first of all, something you're passionate about, something you enjoy, something you're good at, but also ideally something that gives back to society. Because if we start with a mindset that ultimately we are working towards a better society to help ourselves, our communities, then you want to be in a job that's giving back to society. Now, let's just talk about, for example, the drug industry. Let's just, in general, not without naming any particular, companies. Let's talk about what has been the impact of the drug industry, okay, in the last 2 or 3 decades. But before we go there, let's also talk about the impact of modern medicine, because that's, you know, relative. That's also related to this. What is the impact of modern medicine on our increase in life expectancy, for example, in the last 150 years? So there's a great paper which actually surveyed educated American adults, okay, people who had a secondary, you know, had a university education. And they asked these people, of the 40-year increase in life expectancy since 1850, how many of those 40 years are attributable to modern medicine? And the average response was 32 years. So on average, people thought that 80% of the increase in life expectancy since 1850 was because of modern medicine, when nothing could be further from the truth, Brian. It's about 3.5 to 5 years. Most of the increase in life expectancy has come from public health interventions underpinned by regulation, safe drinking water, seatbelts in cars, smoke-free buildings, safer work environments. These are actually what have contributed
refrigeration, refrigeration, better food handling, all those kind of things too.
Absolutely,
right?
Even food, like, so in some ways, safer food, absolutely. This is actually what's contributed. So the question is, how is that perception? And this is a recent paper. So those perceptions are being molded by, well, the biggest influence on, or the biggest influence on public opinion is mainstream media. But what are mainstream media putting out? You know, they're putting out consciously or, you know, subconsciously or whatever, these messages about the power of modern medicine, which often is driven by, you know, big drug companies. and their
You look,
advertising and everything else.
all you have to do is watch the commercials, right? Here in the States, at least. I mean, every other commercial is going to be for a drug company or for a food company, and that's just the way it is. So people are so uh,
Indoctrinated.
indoctrinated, and that's what you see all the time. Say, oh, that looks good, I'm going to go get that out of the fridge, you know. And so there's so much of that going on. But you know, some of the huge points that you're making too are, you know, just going back to you. So look, I had mom and dad at home. They taught me my values and my moral, and now we've lost the family, right? The family's falling apart, and you know, so many single mom and dad trying to do their best, and it's hard when you got a full-time job and you're trying to raise kids, and you got meetings and PTA and sports and all those kind of things. So you know, that's one thing. And then the other thing you said was that how your school influenced you, and that they were teaching you that, hey, it's not just about you. And now it's become all about you and what you want, and not about like reaching out to other people and helping them. Because the most content, happiest people I see, first of all, they're good socially. When they go home, they're happy at home, but also they're helping other people. They're going out there, they have a cause, and they have something they believe in it. And when we talk about, we get so infatuated with the diet sometimes, like the PRP diet, right? If you're living in that environment, it's going to be a lot different than living in the inner city with gangs and shootings and, you know, not having jobs. And, you know, even Tony Hampton, you know, we were talking one time on a podcast, and he said his hospital system is two different parts of Chicago. And he said, in this zip code, you live 22 years longer than in this zip code, just based on, you know, access to care, to, you know, gang violence or whatever it is. And, you know, one's a more affluent area and the other one's a poor area. And you think about smoking and exposures and all that kind of stuff.
Absolutely. Well, actually, at the root of that, the cause of the cause is psychosocial stress. So we know that the conditions in which you are, you know, born, grow, you know, live, work, and age, these are really what we call the social determinants of health. But actually, they're huge drivers of ill health before we even start talking about diet. So, for example, if you are a child that's a victim of severe psychological or, say, sexual abuse, you're going to live 20 years less than average already because of the severe trauma that you're going to experience, right? I've got an affiliation with Stanford in their Metabolic Psychiatry unit, and one thing that, you know, that shocked me, it shouldn't have shocked me because I hadn't looked at it for a while. If you have severe mental illness, specifically bipolar or schizophrenia, then you again have an average life expectancy 20 years less than average. And the primary cause of death is cardiovascular disease, which brings us back to what's the biological mechanism. So when you've got this chronic social stress, it increases inflammatory markers in the blood, it increases markers in the blood that are linked to clotting. So people need to, so you start, and then of course, as you know, the things are, again, then it's going to drive, the stress is going to drive more unhealthy behaviors such as smoking and poor diet, etc. But let's go to the causes of the causes. So we need to think about, how do we restructure society so everybody has an opportunity to live the best possible life they can lead? And we haven't got that. So, you know, people are born into broken homes. They've got no chance. You can't talk about personal responsibility, you know? So this is what we need to really start talking about. And that's where politicians come in. And also the other interesting thing that's when you have more unequal societies, Brian, and of course, UK is like that, America is very unequal, that increases stress for everyone. It's called status anxiety. And interestingly, also, when you look at even businesses, Adam Smith, you know, one of the brains behind the free market, has said that actually to have, for markets to function well, you need perfect information and relative equality. And we have neither. Perfect information because people are being deceived. Certainly medicine and food industry stuff is a typical example, right? With things that they are consuming or buying, right? Or you know, pills they're taking. But relative equality, that's very interesting. So what does that mean? Well, if you're a company and there is a big pay differential between the production worker and the CEO, those companies do less well. And actually on some of these big corporations, big companies, the pay differential is shocking. It's absolutely shocking. The pay differential between the production worker and the CEO in many of these companies, and most of these big companies, is about 300 times difference, Brian.
Yeah, and that's
and by the way, they're working in a system. You know, we talk about the people on the ideologically say on the right, we talk about the free market. There's no free market. That's complete bullshit. It's become the freedom to deceive market. The freedom to deceive market that fuels the business of selling lies, and therefore is also not just a threat to public health. It's a threat to democracy. It's anti-democratic. We're not living in a real democracy. Anyone who says that is completely, you know, ignorant or has the illusion of knowledge. So let's talk about democracy. I'm for democracy. like real democracy. We don't have that anymore. But actually, the reason why we don't have it is because the general population doesn't know what is happening. To quote Noam Chomsky, the economist, the general population and doctors don't know what is happening, and they don't even know that they don't know.
Yeah, it's that brings up, we're a constitutional republic here in the US, right? And you look and you say, okay, you go try to talk to your representative and see how far you get. And it's amazing. I know doctors are part of organizations. They had to pay all kinds of money to have 5 minutes with someone. They sit there for 3 hours. They come in and they have their whole, they go, what do and really it comes down to who has the most money can speak. If you don't have money, forget it. Ain't going to happen. You don't have a word. You can yell at your neighbors and whatever, but it's really a hard thing. We've gotten so, I think when we look at it, even what you were saying with the worker, the first thing I thought of when you said, the workers and the people running the corporation, how much there is a disparity of pay. Look at doctors versus the admin, right? The CEOs of the hospitals and the CFOs, and how much money, when you step back, you've said it a lot. And I know a lot of people, you say, follow the money. And when you follow the money, you think, holy cow, like the conflict of interest is absolutely astounding. I'm shocked by it when I see it. I think, holy cow, how can it be that if I'm pharma and I'm trying to get drugs passed by the FDA and I'm sponsoring you and I'm donating money to you, obviously there's a conflict of interest. It has to be, because if like, you don't pass my drugs, okay, you lose your funding. And then the small drug companies come along and they can't compete. They can't get the ear of these guys. And so it's really, you see how some drugs get thrown through in a month or two, and other ones will take years and years and years of delays. And you think, oh my gosh, it's astounding.
Yeah. In fact, it's interesting you mentioned that, very timely, because I know this is a pre-record to put out probably in the next couple of days. So there's a story breaking tonight, BMJ investigation by a brilliant investigative journalist, one of the best in the world at this, Marian Damasi. And what she's done is she's
amazing.
She's investigated, actually, she's absolutely amazing. She's investigated and looked at the regulators, drug regulators around the world, and whether they're conflicted. And across most of these countries across the world, essentially, most of them, whether it's the FDA or certainly in the UK, the MHRA, or Australia, CGA, most of their funding is coming from pharma. Can you believe that? So think about it. They are the regulators approving drugs, and most of their funding is coming from pharma. Now, how has this happened? It wasn't like that in the late 80s, early 90s. Very little amount of their money came from pharma. This is, and I'm sure it was well-intentioned. I'm sure it was. But there are two politicians that have been responsible for allowing this unchecked power of corporations, or at least letting them unleash on the world with their, and I'm going to come back to, I want to change the narrative. I want people to understand a different way of looking at it, is Margaret Thatcher and Ronald Reagan. So neoliberal economics, they wanted deregulation, the markets are the solution. And what's happened is they've now got more power than they've ever had. But the problem is this, Brian, they are legal entities that are literally just there to make profit and will do anything and everything they can and deceive people and hide data on harms and drugs, for example, or market healthy foods that have the opposite effect on your health, right? Because they're allowed to legally, because the laws are so weak. And then they've got all this unchecked power, and they've unleashed on society. And one of the things that's really interesting is, if people haven't seen this, I asked them to go back and go to YouTube. It's free online to watch it. There's a great documentary it's about 20 years old now. It's called The Corporation. And there's a book written by a law professor called Joel Bakan called The Corporation. And this is fascinating. So in this book, he interviews a forensic psychologist to understand the behavior of corporations, okay? And the forensic psychologist is a chap called Dr. Robert Hare. And he was actually behind the original classification of in the DSM criteria of psychopathy, of psychopath. And in the book, he doesn't talk about individuals in the corporations. He said they compartmentalize. There are people who work in these corporations, CEOs, that are probably great with their family and their friends and live a normal life. But when they are in their corporate role, they have to do what the corporation tells them legally. And that corporation itself behaves, and he says there are many parallels, like a psychopath. And this isn't funny. It's actually, it's well documented. And it made me think, because I recently watched, I'm very friendly with a professor, a doctor in Harvard called John Abramson, who's done a lot of work on litigation over the years and various scandals. And one of the big scandals, as you may remember, was Vioxx. So this was a drug that was produced by drug company Merck, and it was marketed initially as thought to be better than ibuprofen as an anti-inflammatory because it didn't give you, stomach problems. And long story short, ultimately they were found guilty of fraud because there was a huge increase in cardiovascular events. In fact, it's estimated that Vioxx killed 40 to 60,000 Americans, which was the equivalent, as John Abramson pointed out in a podcast with Joe Rogan, which is equivalent to the amount of American soldiers that died in Vietnam. But this is the worst part. It wasn't just a mistake. So internal emails that later came out through the litigation revealed, around the approval time, that there was an email from the chief scientist of Merck at the time. And it said something along the lines of, it's unfortunate about the cardiovascular risk or cardiovascular events with this drug, but the drug will do well and we will do well.
Yeah.
What do you call that kind of behavior, Brian, though? What do you call that kind of?
We saw the same thing,
isn't it?
and we saw the same thing with OxyContin. It's a risk benefit.
These companies, when they commit these fraud, that nobody gets fired, no one loses their job, they're indemnified against that kind of thing. So what the reason I'm saying this, Brian, is, and then whoever's listening to this, if we're really going to change the system and sort these problems out at the root, it has to happen through legal means. It has to happen through changes in the law. And these people will do everything they can to protect their interests, because as late as 1999, the CEOs of every major tobacco firm went in front of US Congress and swore under oath they did not believe that nicotine was addictive or smoking caused lung cancer. And many of these industries adopt the corporate playbook of tobacco. It took 50 years between, the clear links between smoking and lung cancer before any regulation. And the reason it took such a long time is that tobacco adopted this playbook called Dirty Tricks Playbook of planting doubt that cigarettes were harmful, confusing the public, buying the loyalty of, dare I say it, bent scientists, and downright denial. And actually that corporate playbook is utilized by many other industries still. And the framework and mechanisms of how these corporations exert their power are really through political, so through lobbying. For example, in the US, that didn't used to be legal, Brian. We've allowed it somehow. I don't know if that's happened. It hasn't happened through democratic means. I don't think the majority of the American public said, we want big corporations to be able to give money to different politicians and political parties to act on our behalf. That didn't happen through democratic means. So you've got lobbying, revolving doors. You've got preference shaping. So, philanthropic organizations, capture of the media, marketing and advertising. 80% of the media in the US is owned by 7 corporations. Philanthropic organizations, for example, you look at the Bill and Melinda Gates Foundation, okay? Huge influence at the moment in the world. And I didn't know this, but do you know the Bill and Melinda Gates Foundation is heavily invested stocks in McDonald's, Coca-Cola, and pharmaceutical industry? Notice how Bill Gates never talks about tackling chronic disease and lifestyle-related disease? Never talks about it. I wonder why.
And he invested a ton of money in BioNTech, which no one ever heard of. He invested, I forget, it's ridiculous how much money he made.
So he's got too much influence. He may be well-intentioned, but there's too much influence. And of course, money clouds judgment.
And the World Health Organization.
Then you've got corporate control of the knowledge environment. So funding, for example, of research. So most of the research now that influences clinical decision-making or university research comes from the drug industry. So they are allowed to, they develop products, they test their own products, and then they keep hold of the data, and then we're supposed to just trust them? I mean, come on, people need to wake up, right? Then they've got legal control of the, limited liability, for example. And then extra legal, which is opposition fragmentation, tax evasion. Opposition fragmentation is they want to keep anything that threatens their interests through a conflict with what's going on with the public or, people who have, responsibilities to integrity and scientific integrity want to raise it. They will smear campaigns. What they're producing is junk science, deplatforming. We've seen more recently around COVID. So this is what they do. So people need to understand this is how they have got, it's not a conspiracy, Brian. It's the way business is done. And it's about too much power to really entities that have been documented as acting in psychopathic ways.
Yeah, and that's the thing is, being chief resident, that was an educational year for me at my institution, because all these grand rounds that they give are all pharma sponsored. They're paying their speaking fees, so they're flying people around the country, and this person is going from med school to residency to med school, giving PowerPoint presentation that's predetermined. So it's what industry tells you to teach. So these drug meetings, I've been approached before in the past, in my remote past, to say, hey, what do you want to talk about this medicine that you're using? We'll pay you X number of dollars. You go and speak to a bunch of doctors at a dinner party, and it's all funded. But they go, you don't even have to do anything. It's all prepared for you already. Like when we give a talk, you have to prepare your talk, and that's what takes all the time.
for that reason, I've stopped going to cardiology conferences that are sponsored by the drug industry.
Yeah, and
because
they're
I know I'm not
sponsored.
going to, because I know I'm not going to get the truth.
Yeah, and it's a hard thing. It's really hard. And then when someone like you stands up, they go, look at this crazy guy, and you have all these supposedly expert cardiologists saying this guy's crazy, but they're all indoctrinated. So it's like if you're in a cult, you know, I mean, if everyone else is in a cult and you're not, you go, wait, you guys are doing crazy stuff, then right. And now, and I think it's come to an extreme. I think this is an important topic too, is that when you do question, say, wait a minute, here's what my data is showing, here's what I'm seeing in my clinic, then they say, well, that's medical misinformation, and you could get your license taken for that. And so, you know, I know you've had battles, and people have made your life difficult because you question the system, right? Not even saying you know the other answer, but you're saying, look, there's certain things we do know, and one of the points you raise is, psychosocial stress, anxiety, tension, and now I'm looking at doctors thinking, uh-oh, like now that I'm out of the system a bit, I can look back and say, oh my gosh, look what's coming. I mean, these doctors are burned out. They don't care. You're just another number. It's so sad to see, because this is the most intimate profession in the world. This is a calling. Yes. It's not right. And so when Absolutely. You see it, and now what gets rewarded in medicine is how efficient you can be. If you can see X number of patients
it's false efficiency though. It's fake. Because if it was really effective, Brian, why is the health of the population deteriorating? People need to just wake up, and even that in itself could be enough for them to think, hold on a minute. For me, that's where I started my journey 10 years ago, because I could see what was coming. I knew that patients were coming with more illnesses, more misery, more obesity. And I also then started looking at a lot of the data on some of the things we do and realized that the benefits are very marginal at best and the harms are underplayed. And now we've got data telling us, at least certainly one analysis from Peter Gosha, co-founder of the Cochrane collaboration, suggests prescribed medications are the third, biggest cause of death after heart disease and cancer globally because of side effects, which are entirely preventable.
And so, you just posted a paper too. It was like 6% of these drugs have been really vetted appropriately.
Yeah. So actually, so we'll come back to the thing I mentioned earlier on. So if you look at what's been the impact of the pharmaceutical industry in the last 2 or 3 decades, because people might be hearing saying, hold on a minute, what about these blockbuster drugs and medical innovation? Medical innovation has become an illusion. So Marcy Angel, the former editor of New England Journal of Medicine, she published an analysis and talked about it in a conference, and you can look at this up on YouTube. And she revealed that between 2000 and 2008, the 667 drugs approved by the FDA, the overwhelming majority were just copies of old ones. And this has been replicated around the world. In France, a similar analysis, same sort of time frame, revealed most of the new drugs produced were copies of old ones. So they're patented. So you can so think about the waste in the system as well. We're spending all this money on these new drugs that are being approved under the belief that they're more effective than the previous drug when they're no different. In fact, the previous drug is cheaper, a lot cheaper, and probably even maybe safer. But in France, they found that it was roughly 15% of the drugs that were produced were actually found to be more harmful than beneficial, versus about 8% that had some added benefit. So what do we conclude from this? Most drugs are copies of old ones. Probably more drugs are being produced that are harmful than beneficial, or certainly a therapeutic benefit compared to before. What's the conclusion? Without any shadow of a doubt, the overwhelming evidence tells us, certainly in the last 2 or 3 decades, the overall net effect on the pharmaceutical industry on society is a negative one. Not just is it a negative one in terms of their health, it's a negative one in terms of their undermining the principles of democracy. So the two of the biggest enemies of democracy are the food industry and the pharmaceutical industry. And that's how we need to start talking about them.
Yeah, and it's hard because, the food industry has these fancy commercials with cartoons and all the kids love it. And we get indoctrinated at a young age, and it's like, like what you were talking about with tobacco, when they saw the writing on the wall, all these companies divested and started purchasing the fast food and the processed food companies. And then they took the cigarettes out of the machines and they put in the cookies and donuts and cakes in there. Right. So, then they know they bought 40 more years by the time people figure it out. And that's why for you, one of the big things you were mentioning is saying, okay, look, if we can lower the insulin, we can lower the sugars, and so many people are seeing that if we decrease that chronic inflammation, we all know that if you're in a chronic inflamed state, you're at an increased risk of heart attack, strokes, and all these cardiovascular disease. So if you're chronically inflamed, chronically stressed, anxious, depressed, not sleeping, all these things that we're going through, we make things worse. And as a matter of fact, I saw criticism of your 21-day immunity diet plan. They said, "Who diet can't have?" Like, your critics would say, "Diet can't have an effect." I'm saying, I'm seeing people drop their insulin half in a week, right, from huge levels, and I'm seeing the sugars get under control.
So
and
you
we know that.
Brian, what's worse than ignorance? The illusion of knowledge.
Yeah,
so the people making
problem.
these comments have got no experience of this, mostly, and that's part of the problem as well. So, you know, they have no experience of doing this with their patients. I mean, how many diabetes specialists do you know, right? Eminent diabetes specialists who can say, I've reversed my type 2 diabetes or send my patients with type 2 diabetes remission? Very few. So actually, that should be a question. We should be judging doctors. Well, how many of your patients have you got off their pills from lifestyle change? Shouldn't that be something that people should be striving for?
Well, I'll tell you, you know, when I was looking at, you know, I gave a talk on medicine deprescribing, which there was nothing there. No one talks about deprescribing. Once you put it on, no one wants to take it away because they're afraid once I take that away and something happens, then it's my problem. So we just keep adding and adding and adding.
Well, this is what we call the illusion of knowledge, right? Or ignorance.
Instead of saying, why is this happening?
And that actually relates to something else. And this is something we need to change. It's not like me speaking, you know, sort of waving my finger. It's frustrating because this evidence has been there for a long time. It just hasn't got into the mainstream because it's being suppressed on purpose. And that is the fact that, you know, most doctors, so first of all, one of the reasons most doctors are not aware, okay, of poor quality research that contributes to overuse, underuse of alternatives and, you know, safe or effective treatments or lifestyle, avoidable adverse events, waste and missed opportunities for right care. You know, 20 to 50% of healthcare activity in the United States brings no benefit to the patients, right? There's a great paper, people want to read this as an educational tool. It's called How to Survive the Medical Misinformation Mess. It's written by John Ioannidis, professor of medicine at Stanford. You know, I consider him a Stephen Hawking-like figure of medicine because he's the most cited medical researcher in the world, a brilliant man.
And he said, and despite that, I just want to make it, when COVID came, he said, look, here's why the lockdowns are at the very beginning. He said, this is why, and I read his paper, I'm like, oh, and then he got destroyed in the media. Everyone said this guy's crazy. And you go, look, this is a leader, just like what we're seeing with Peter McCullough. These people did not all go crazy on the same day. The odds of that happening with great scientists who've had their integrity, they have what they built, and he got absolutely destroyed. And then you look back and like all of his predictions are true. Now what?
Yeah.
Do you go back and apologize to him now? And these people who are slandering him and treating him terrible, I don't know the guy, but I've seen what he's been saying. He said these guys that you're modeling after have been a disaster for the history of the world.
Yeah. What the lesson teacher does is somebody like him of his stature to be attacked like that and smeared is the science alone is not enough. Opposition from vested interest needs to be overcome. But Brian, most people want to do the right thing. Most people
get back to the paper. I'm sorry for interrupting. I just want to make that point.
Yeah, so he basically cites 4 things. He says that most published research is of poor quality, unreliable, not relevant to patients. Most doctors are not aware of this problem. Because they're not aware of it, it's not being tackled. And even if they are, they lack the necessary skills to critically appraise the research. And then patients and families lack relevant information at the time of shared decision-making or informed decision-making. So there's a lot more we can do, and it's not rocket science, but actually just even breaking the research down in a way that's easy for patients to understand. Let's take statins, for example. You know, people may think, people who don't know my work or may just read media stories or whatever, may think, oh, Dr. Malhotra is against statins. I'm not against statins. I'm against lack of transparency in their prescription. I'm very pro-informed consent. That's our duty as doctors. But informed consent also means transparent communication of risk and benefit of any intervention. So what it is about breaking it down. And when you look at low risk, the majority of people, when they're told, you know, if they've got low risk of heart disease, and that's most people taking statins, are not told, by the way, that there's only a 1% chance based upon industry-sponsored data where they've controlled the data and is their likely best case scenario. There's a 1% chance it'll prevent you having a non-fatal heart attack or stroke in the next 5 years. It won't prolong your life. They're not told that. So it's about
not only that. In your case, I remember I always forget the name of it, but you were giving testimony before a huge panel, and you said, "Look, you were talking about President Bush riding his mountain bike through the mountains all weekend, and then he comes in, he's had no chest pain, no nothing, stress test positive, they put a stent in him."
Yeah,
and the president of the United States.
I'm sure George Bush was not told that stents will, not prevent him having a heart attack or prolong his life. and are purely being put in for symptoms if medical therapy fails. I'm pretty sure, don't know for sure, but I'm pretty sure he wasn't told that. And I wrote an article in the BMJ called Too Much Angioplasty. And in fact, that was where I mentioned that for the first time. And then I wrote another article in JAMA Internal Medicine. And then that was press release and made BBC News. And it was about, you know, cardiologists should be giving full information to patients before stenting them, which obviously upset the interventional cardiology community a little bit. But, you know, the truth is the truth, and we're here to look after patients. So it is what it is.
Yeah, and that's why, you know, what I've seen in all the big leaders like yourself, Noakes, Fedke, they all took a loss by doing the right thing, right? So, you know, Noakes could have walked off into the sunset, been the most published guy in South African history, and said, okay, it's not my fight, let it go, right? But he fought it. He stood there and fought it. And he had all the data. And Gary Fedke, the same thing. And I asked them both, why didn't you quit? And they said, look, we were the only ones in the position to do that because these young doctors coming out, they owe a ton in med school loans. Like, I'm still paying my school loans, and I'm an old dude with gray hair.
Yeah.
And you start realizing these guys are in a situation where you told the party line, just like what we were talking about before, is, okay, you're either going to pass this or you're going to make this happen. If not, you're gone, and we'll bring someone else in who will. And it's hard because people compromise their integrity because they're looking and saying, look, I got to maintain my family. My wife's going to leave me if I lose my job.
Yeah,
and
but, but I think what they don't realize, if they think very rationally, compromising one's integrity has an effect on society if everybody's doing it. And then society goes towards hell, essentially. And that's where we're going, Brian.
Yeah,
we're going there because people compromise their integrity.
Exactly right. You know? And I think that's it. And people like you who maintain your integrity say, look, I'm going to fight the fight. But the amount of arrows that come against the one person who maintains their integrity is the problem, right? When you say,
I'm sure. And that is something that, you know, when I started this journey, I couldn't have predicted it. But then that's also a test, because some people, they come out and they say something, and then the real test of their character is how they deal with the arrows. And some people just can't take it. They say that I've had enough. I can't take this. I can't handle it. And others carry on. And I think for me, you know, there's a great paper on lessons in public health advocacy written by a chap called Simon Chapman in Australia, who's considered one of the leading voices in tobacco control in Australia. And he talks about his 38-year career in public health advocacy. And one of his lessons is, you know, grow a rhinoceros hide. Because as soon as your work threatens an industry or an ideological cabal, you will be attacked, sometimes relentlessly and maliciously, you know. And that's basically, and I've experienced that on several occasions. But I'm still here. I'm still alive. You know, despite the fact I'm one of the biggest critics of the drug industry, certainly in Europe, publicly and through mainstream media, I'm still here, and I'm still trying to make noise for the purposes of public health and for the purposes of truth and transparency, and, you know, to make medicine great again. Because if anyone's going to change this, Brian, we're still, certainly in this country, the most trusted profession, you know, and this is on us. It's our responsibility. No one else is going to do it. And we have the power, and patients still trust us. But it's about galvanizing it. It's about communicating it properly. It's about having compassion with people with different views to us. It's about convincing the guy that sends you smearing attacks sometimes, you know, actually thinking, can I engage in a conversation with this person and get him to change, or at least think differently? So we have to take the higher ground. They go low, we go high. We have to think about it. And it's not easy. I'm not saying it's easy, but that's the way forward.
Well, the way forward is if you have open discussion, right? Say you believe in Buddhism and I'm a Christian. I go, okay, what is beautiful about your religion that I can pick up and use that in my life, right? And says, you're wrong, I'm right. And you say, well, I like that. Like, you know, I just had a Jewish, someone of Jewish faith on, and I said, what do you guys, you know, what's the, and they said, well, we do a Sabbath every Friday night. We turn the lights off, we turn off electricity, and we sit and talk and we spend time together, and their marriage is very strong. And you look and you're like, oh, okay, that's kind of cool. I like that. There's certain things you look at and you say, wow, if you have peace, go sit by the pond or whatever. But finding your peace, finding your way, finding your calling in life, you're going to do better. And that's I think it's a huge stress. The doctors I talk to are totally burned out. I mean, this physician burnout is a major problem that people aren't really discussing.
And they're burned out because of the stress on the system, because we haven't dealt with the root cause of the problem, right? And that's why they're burnt out. And then you get compassion fatigue, right? So then patients also get a bad deal doubly. Not just are they not getting access to care or not getting the best care, they're also not getting the right attitude. And the right attitude because morale is low and people are burnt out. And the whole system's a mess, you know? So, you know, a treatment based upon a faulty causal analysis will lead to the wrong outcome. And that's what we got, mate.
So what do we do, Doc? How do we fix it?
Okay.
I mean, it's
So
a
there is a way.
disaster.
There is a way. We've got a huge injustice going on in the world. So what do? Well, I learned from other people that I followed, how they did created their own revolutions, whether it's Martin Luther King or Mahatma Gandhi, Nelson Mandela. Make the injustice visible. Most people, I think, still want to do the right thing, and they just don't know what's really going on. But how do you do that? And this is a challenge. Certainly in America, it's more challenging, but it's not impossible. The biggest influence on public opinion, private advocacy has some role to play, but it's going to be public advocacy, is getting something into the mainstream media. That's really where you can change people's opinions and have, and argue from a place of integrity and a place of evidence. And that's how you do it. That's how you do it.
And that's what you've done. You've gone into the lion's den and talked about stuff. I've seen Zuby doing that.
You'll be amazed. Policymakers and politicians, as well as the public, are also influenced by the mainstream media. When you look at some of the stuff going on, say on statins or other drugs, or without naming anything in particular, we've talked about this before. It's amazing. Medical leadership, even people at the very highest levels of medical leadership, or people who are supposedly influencing policy. When you ask them where they get their information from on a particular drug that they're talking about or trying to influence policy on in medical guidelines, mainstream media. More recently, Rochelle Walensky, the former chair of the CDC, said that her optimism, we're not talking obviously about, there's not a discussion about the vaccine, but she said her optimism about the effectiveness of the Pfizer vaccine, she said, came from CNN.
Yeah, and she said, and they said, what did you base that on? Hope. We hoped it would be that. Well, I don't care what you hope,
but that's
what it is.
Story. Paul Thacker, who's an investigative journalist who wrote for the BMJ, he looked at this and blogged on it. That story on CNN about the effectiveness of the Pfizer vaccine, it was almost verbatim a reproduction of Pfizer's press release.
Exactly. Yeah.
Think about that. Just think about that.
It's unbelievable. It is, like, we've been through an unbelievable. I think these two, like what you said, is public awareness. When people look and say, look, here's what I'm seeing in clinic. Like, as a matter of fact, I don't know if, I think it happened after we talked, but I got taken off social media for 6 weeks from YouTube in particular, because I had an old doc on talking about what he was seeing in clinic the last 2 weeks. He's a hospice doctor. And he said, here's what I've seen. And he told his cases. And it got taken down for medical misinformation. He got medical misinformation for saying what he was truly saying. No one contacted him and said, hey, we want to see your records to see if this is true.
Was that in relation to a recent prophylactic drug that lots of people have been taking?
Yes, it was, actually.
Okay.
And so that's why. And so you're looking like, wow, where's the power to really, like, some little podcast like this?
This comes into opposition fragmentation. So there's a really good framework of how corporations exert their power and influence. And this comes at opposition fragmentation. So you effectively deplatformed. Now, what people don't know, and I'm going to say it, and it's fine, it's a fact. So during COVID, Facebook partnered with one company specifically, a few, but one of the major ones, to decide on what was medical misinformation, and also to tackle vaccine hesitancy. It's there. It's on there. You can look at it and Google.
Yeah, we know that. That's
Guess
true.
Who that company is? Guess who that company is? Merck.
No conflict of interest there.
If people want to listen, if people listening to this, just Google and put in Google, Facebook partner with Merck, okay? And you'll see what the article that comes up and see how much they invested into that. So it's a bit of a problem, isn't it, really? So that's why I say we've got suppression of free speech as well. That's America is built on free speech, but we haven't got free speech in the United States anymore.
Well, the Professor Noakes and I talked about, like, we would have grand rounds and you say, okay, I think this is the best approach to cardiac disease. Here's what I think. Here's my outcomes. Here's the data on my side. Here's the data on your side. And you discuss it. Medicine doesn't progress unless we do that. Nothing progresses unless we do that. We go, there's a problem. Yeah. Let's look at it. But if you say, if you don't go with this is the only treatment we're going to allow. And if you do anything different, then we're coming after you and take your license.
Yeah. And as you know, people are then only getting one version of the truth, right? Or misleading information. And those are societies that we don't want to live in, those sorts of societies. And you combine that with increasing hostility and polarization, then we're also losing our capacity for empathy. So we're losing access to the truth and our capacity for empathy. And that's devastating for society.
Yeah, and not only that, it's what knowing your position on certain topics social media will just show you a bunch of data that's confirming your view. And if you have a different view, you see stuff confirming your different view. And then we both think the other side is totally crazy because all we see is the positive or the negative on any treatment that we're doing or whatever it is, social. So it's really challenging. And their thing is say, hey, let's keep you on social media fighting as much as you can. We get paid more because our advertisers are going to come through, right? So it's, you know, the financial thing, compromise integrity, all those things I think are becoming very clear to people and they know who has their best interest. Guys like you who stand up at huge risk. I mean, you know, I know that you got, you know, kicked out of certain medical stuff. They say you're too controversial. We can't have you here, right? Those kind of things happen.
Oh yeah,
think, gosh,
I've been disinvited to give talks because government officials have contacted a hospital. In fact, the Sunday Times did a news story on this because my diet plan was endorsed by the chair of the Medical Royal College. Of course, when I say diet, it's actually dieta lifestyle. But, you know, But and then the chief executive of Public Health England, the government body, contacted various people in endorse the book, prominent people, including the mayor of Manchester, and asked them whether they would withdraw their support. And then, so, you know, this is what kind of goes on behind the scenes. Luckily, they all stood firm. And then Sunday Times did a story exposing it. And it was something like Tom Watson was a former deputy leader of the Labour Party. And when he was deputy leader, he lost 100 pounds following my diet plan. I didn't even know. He was contacting me saying, I read your book and it's amazing. And the headline of that article, that story was Tom Watson's diet doctor hit by government dirty tricks campaign, which is great because that's also exposing those guys, you know. And sunlight is a very potent disinfectant for malodorous health policy.
Well, and having a patient lose 100 pounds too through lifestyle, that argues the point for you,
and
right?
For him, it was specifically just going low carb, Brian. That was it. Yeah. It was basically low carb.
Yeah, no, I see him posting. I like him. You know, I think it's great. But, you know, I think we need more people to say, let me look at that and reassess. And I think we have to have an open mind.
We all have a role to play, Brian. And I think that you can't just leave it to people like me and Tim Noakes and Gary because, you know, we are more exposed. But again, what we do is we galvanize people. I'm now, you know, I've got this presidency role, president of the Scientific Advisory Committee, specifically of the Public Health Collaboration, which is a registered charity made up of doctors and members of the public. And we're an army of 500. And we're ready to, you know, to try and push things further and ultimately to help people make healthy decisions, but also, you know, help push for policies that are going to give people the best chance of living a healthy life. And that's what we're going to be doing. And I think, you know, it's easy to take one man down. It's not so easy to take down an army.
Yeah, and that's what it is. You have to change the standard of care and you have to say, okay, let's get people who are practicing and what they're actually seeing and what's happening, because separated, we're going to struggle. I mean, the more we can come together and say, let's reassess what we're doing. I think, you know, it's a hard thing. And I think there's going to be a power shift in medicine. I really do. I think there's people like yourself who are going to take over and say, look, we have to look out for public interest. We have to help people. And you're very, I don't know the word, but socially aware. You want to help people. That's clear in everything you do. And the attacks you take as a result it's unbelievable to me. I see it. And I don't even comment. I look on Twitter and go, holy cow, who are these? They have no idea what they're, you know, it's the same thing as I saw with Professor Noakes. He has med students criticizing him. And you're like, this guy's the most published guy. He's done all this stuff. He has clinical experience. He's changed his views on stuff based on the data. And you've never treated a patient, and all of a sudden you know way better than these guys who've been practicing for 45 or 50 years.
Most
you know,
of the responses they're just emotional responses, Brian. You know, and I think social media, unfortunately, as you said already, exacerbates that kind of toxic behavior, and it's kind of designed to do that, just because that's what increases engagement. I don't think they deliberately set out to do that, but that's the algorithms. Like,
it'll be interesting to see how many are bots that aren't real people. Like, I don't argue because when they're probably, so outlandish.
Paid for by pharma, right? They probably spent 100. Let's go after Malhotra here. Let's put
$1 million or 100,000. Waste his time, and that's why I look and I was like, gosh, you know, the trolling and all that stuff. I don't have time for that. I don't even look back at the comments anymore. But for you, I got to ask you. I want to be respectful of your time. We're coming up on an hour.
Yeah.
What's life's best medicine for you? What gets you going? Where do you find your peace? What keeps you moving forward when you're like walking in quicksand sometimes?
Wow, that's a great question. What keeps me going forward? Hope keeps me going forward. That we are moving towards, we can create a better world, and also self-belief. You know, that knowing in my own heart where I'm coming from, you know, as a place of integrity, and also having confidence in my own mind, my ability to critically analyze things, but also knowing that there's a big emotional component to our behavior. So I think it's hope for a better future, but knowing that if I don't do it, and we can all apply this to ourselves, if I don't do this, nobody else is going to do it. That's what keeps me going.
Yeah, and I appreciate your leadership and for standing up. I mean, I remember early on watching what you were talking about. I was like, holy cow, this guy's crazy going after these guys. You know, it's David and Goliath. It really is. It's one of those stories of
and Brian, I'd add on this, my biggest motivators are my own patients and their feedback. You know, when they get better and they come to me, and some of them are in tears, and they know they've been helped, but they also see what's going on, and they're like, Dr. Malhotra, please keep going. We support you. And that keeps me going for sure.
Yeah. And I think that's it. I think that is the big for us, for a lot of us. And this has come up over and over in talking to people pushing low carb or lifestyle change or stress management, all these sleep, all these other things, these other factors is, you know, the doctors are happier. They're helping each other. They're sharing what they're doing, and their patients they get the satisfied. I have people, like a lady I just talked to yesterday. She's lost like 58 pounds. She looks great. They didn't recognize her at the wedding she was at, and, you know, all those kind of things, but it was a slow progress. Right. And she was frustrating a lot of the time. Then she looked back and said, wow, look at this pictures. And when you see that, you get that joy of just thinking. You put people on insulin, they get amputations, they go blind, their kid, there's no joy in that. There's no joy in that. So when you start seeing people getting better, and plus I think in our experience, we've realized we've seen the disasters, and we can prevent the disasters. No one even knows that what we prevented down the road. Right. Because if you wait till you get all these complications, then you try fixing it, then it's too late. And that's, you know, that's the thing, is that we can prevent. I mean, us frontline doctors should be preventing illness and preventing the hospitalization, preventing, you know, these sicknesses from getting worse, or, you know, really focusing on the depression, anxiety, the stress, and all these other things. But if you have a 6-minute appointment, forget it. You can't address those things. You gotta say, here's a drug, see you next time. Right. And then be more efficient. So I think there's some big changes that have to come, but I'm so glad that you're on the front lines doing this stuff, because, you know, you're really, and I know you have a big paper that's coming out. So when that comes out, I would love to have you on and just talk about it and bring some public knowledge.
That'd be great, Brian. No, of course, I'll be delighted.
All right. Keep up the fight, man. Have a great weekend.
Right,
and thanks again for joining me. I appreciate it.
Thank you.
Thank you for listening to this episode. We greatly appreciate your support. We would greatly appreciate a positive thumbs up on all of the platforms like iTunes and Spotify, or wherever you're listening. And we just thank you for our Patreon supporters. We greatly appreciate your help in getting this message out. We think there's a lot of important information, and hopefully this helps you. You know, have a great day, and thank you for listening, and thank you for your support.